Hello friends, today we will be talking about the importance of diet in pregnancy. As we all know, a healthy mother will give birth to a healthy child. Now, how do we achieve that? That is, the first and foremost thing being we have to look at it trimester-wise, that is every 3 months. Now, in the first trimester, that is from the part of conception till 3 months of intrauterine life, the instructions would be that is to get adjusted to the new environment that the mother is facing. That is, the mother might have a few nauseating feelings or vomiting episodes might be on the higher side. So to alleviate that, it is important that you stay put to whatever routine food that you are already taking, and only to make sure that you're taking small meals but frequent meals, so that your body is getting used to digesting it in a better way and it is getting utilized also perfectly. Now, also the other point being your eating window has to be longer and the fasting window has to be as short as possible. So make sure that you're getting up early in the morning, having something, even if you go back to bed or rest, it is fine. But it's important that you have a good, heavy, nutritionally home cooked food in the breakfast, and then every 2 to 3 hours you can have a good meal. So the timing wise, if we see, we prefer that the first meal is between 6 to 7 a.m. Then the second breakfast would be between 8 to 9 a.m. Then a small fruit at around 10 to 10:30 a.m. And then your lunch, which should be a wholesome lunch. That is, you can have roti, sabzi, you can have your dal, and you can add a small salad in that. Now, post that around 4 o'clock, it can be a very light meal again. But post that around 5 to 6 p.m., it is necessary to have a heavy snack again. Evening snack should not be missed. Otherwise, you will experience more of acidity symptoms or vomiting at the night. And then around 7 o'clock, you should have again a small fruit. And then by the dinner can be around 9 to 10 p.m. And then if you're going to sleep late, or you have a tendency to remain awake after 12 o'clock, then it is necessary that around 11 p.m. to 12 a.m. you have something light again, so that the body is continuously having some or the other food resource inside the stomach, and your baby is also continuously getting the nutrition. Now, as regards the foods that should be preferred is, as I said, in the first trimester, it is necessary to remain in the bracket of whatever you are continuously eating, your body is already tuned up to. But later on, after you complete with the first trimester, in the fourth month, what you can go ahead with is adding on nutritionally rich food and protein rich food. So in that, you can go ahead with dry fruit intake like walnuts, almonds, anjeer, kesar, which in the Indian diet it is said that it is important for the pregnancy, so that you can add on after the fourth month. And also any other food that your traditionally somebody tells you that this is important, then you can start. But the medically whatever food that you should not be taking post fourth month is in vegetarian sources, in fruits, that is, you should be avoiding papaya, pineapple, and ripe mango, but you can have a little of the raw mango. Post that, in non-vegetarian sources, maybe you can avoid with a little of chicken, but you should have a good source of eggs, which is really like a wholesome protein, and it is good for like easily assimilable in the body, and it is good for the baby as well, because the baby is going to form its own muscles, its own blood vessels and everything. For that, protein is a very essential nutrient. So post that, like in protein sources, other than that, if you look at the veg sources, it would be soya bean, paneer, green peas, milk intake, roasted peanuts. So this is the veg sources of protein. And in non-veg sources, as we were talking, so egg is a good source, and you can have mutton, you can have fish. But in fish, it is necessary to restrict to the usual fishes that we have and not have shelled fishes. So prawns, crab should not be taken, and heaty fishes like mackerel and all that should not be taken. So looking at the beverages, if we are looking at it, then tea, coffee, that should be reduced in quantity if you cannot completely avoid it. But if you can avoid it, it is even better for the child, because all those whatever increases the heart rate should be taken at the minimum. Then caffeinated beverages are out. Cold drinks also will only give you empty calories. So it is important that you should stick on to homemade like soups, juices, buttermilk, all those things you can have in good quantity. Alcohol and smoking, yes, has to be completely stopped during the pregnancy time. So that is one important thing. And it is also important that you have a very positive outlook to whatever you're eating, because during eating also you should feel good about yourself. You should feel happy about whatever you're doing for your baby. So it should not be taken as a punishment and thought about. So that all the good vibes and good thinking goes towards the eating also. It gives you a balanced diet also, and it is always going to have a very healthy child. Now, healthy child would be anything the birth weight more than 2.5 kg. So, this diet, is it helping your baby or not, will be evident by your routine checkups done by the obstetrician. So, they will help you by doing the sonography and a regular per abdomen examination, and that will give us an idea if, first thing, if your weight is improving as it should, and the second point being, is the sonography giving us a perfect weight gain of the baby or no. Other than that, if there is any abnormality in the sonography which is seen, then the obstetrician will give you an extra dietary advice of how it can be improved, and also remedial measures in the form of medicines will be added to ensure that you have a healthy baby. So, a balanced diet during pregnancy is a gift that you can give to yourself as well as your baby. And so, stay hydrated, avoid risky foods, and remember, every bite that you take will shape your baby's future. Thank you.